foundation consists of the history. You should see them on your screen, 6 items: history, examination, diagnosis, goals need to be set for the patient. You need to list the services you're rendering plus the clinical rationale. Number 5 on this list is where we're going to be getting into a lot of detail, and then the schedule of care. So let's just start with the history. Mr. Jones walks in with low back pain and neck pain. Okay. So what are you going to do? You're going to ask Mr. Jones, how did it start? When did it start, right? That's called the history. Some of you call it the consultation. There are 4 levels of consultations or histories: a problem-focused, an expanded problem-focused, a detailed, and a comprehensive. So before you could even build the therapeutic procedures and modalities, you need to talk to the patient. You need to do a history. So according to the E&M guidelines, there are 4 levels or 4 types of histories. Now, I'm just going to focus right now, just to keep it simple, on CPT code 99203. That's the most commonly billed new patient CPT code. So a detailed history means that you have spoken to the patient and written down at least 1 chief complaint, 4 items in the HPI column, which is the history of present illness. 2 to 9 systems need to be reviewed, and 1 item from the past history, family history, or social history. So again, when you are writing down what the patient has told you for the initial visit, again, back to Mr. Jones. So Mr. Jones presents today complaining of low back pain and neck pain. There are your chief complaints. The HPI, the history of present illness, or maybe in chiropracticology, we're taught this as the OPQRST. So Mr. Jones says the pain is radiating into his thigh. It's sharp. It's worse in the morning. Ice makes it feel better, right? So you're going to go through the OPQRST or the HPI, history of present illness. You need to write down 4 of those. That's for CPT code 99203. Also, when you are documenting the history or consultation portion of this visit, you need to review systems, 2 to 9. According to the E&M guidelines for CPT code 99203, you need to review 2 to 9 systems. And then we have the past history, family history, or social history. Just need to document 1 of those. So what's a quick example of a past history? Mr. Jones, have you ever had any trauma to your spine? I mean, that's a question that every chiropractor, physical therapist, orthopedist, anyone treating patients with musculoskeletal pain, that is a required question. Have you ever had any trauma injuries to your spine? So that's an example of a past history. You need 1 of those from that category: past history, family history, or social history. So that's the history portion of the visit. So please make sure you're documenting all of that. Next part of the care plan, and you see the little photo in the bottom right corner, that's a table. You're setting the table. So we need to continue to set the table before we could start billing and performing therapeutic procedures. So the next step is the exam. Okay, so you finished talking to the patient. Now you're doing an exam on the patient. Again, according to the E&M guidelines for CPT code 99203, there are 4 levels: problem-focused, expanded problem-focused, detailed, comprehensive. 99203 means you did a detailed exam. A detailed exam should include 12 exam findings. They could be positive or negative, but you need to include 12 exam findings. But remember, you need to know what constitutes a finding. If you say, Mr. Jones, turn your head to the right, and it feels painful and restricted, and then you say, okay, Mr. Jones,